No, we can see you, Jim.
Well, this is new for all of us, so I'm excited that we're able to make this work and figure it out, and I think this is really going to be great. So I appreciate everyone being here. We'll have a number of people who are joining right now, so we'll wait a couple of minutes, then I'll go ahead and introduce everyone and get started.
All righty.
Sounds good? Thumbs up.
Yep, looks good. Talk about using something I never heard of. Never heard of Zoom before. Of course, that's true of me with most things electronically and technologically, but holy smokes, we're getting with our family and everything on Zoom.
Yeah.
I've gotten so many emails. It's been wonderful. I'm frantically getting emails even right now. So I'm with people who are wanting to join. So let me send these couple of emails. We'll be ready to start.
Now the people who are logged in will be able to see what we see?
Yeah.
Okay.
Okay. I thought it was going to be a Zoom screen with about 500 images on it, Tim.
No. Yeah, I asked that question earlier.
Yeah.
They will give the questions to Tim, who will ask the question.
You got a number of questions to run through anyways, Tim, right?
I do. Yeah, questions I had and questions that people have already sent me.
Okay, very good.
Hey, Jessica. You still? I guess you're on mute. You still even have a red wall behind you.
This company.
Well, it is 12:01. It's 12:01. We are already up to 77 participants. We'll give everyone about another minute, and I'll go ahead and introduce our panelists and get started. Sound good?
Very good, Tim.
Yep.
Excellent. All right, everyone. Well, thank you so much for joining us this afternoon. Happy day, happy noon, and I'm very excited to be here. My name is Tim Lewis, and I work for the American Heart Association as a Community Impact Director covering Northwest Ohio. So as a kind of an introduction, I just wanted to kind of talk a little bit about the purpose of today's call. And I work for the American Heart Association, and the American Heart Association is working with researchers, medical experts, community leaders, businesses, families, and more to reduce the impact of the coronavirus. We are always committed to supporting our heart and stroke patients and their caregivers by providing a network of resources and emotional support. Our top priority during this time and at all times is the health and well-being of all individuals and their families today and in the future, in every community, everywhere. This virus is impacting everyone, regardless of race, age, religion, and gender. We recognize that there may be an increased risk of contracting COVID-19 for the approximately 120 million people in the United States who currently have one or more cardiovascular diseases, and that it is often more serious in those who have cardiovascular disease, including congenital heart defects, diabetes, or high blood pressure. This situation, as we all know, is rapidly changing, and scientists and medical professionals are learning more every day. So thank you all for being here. I'm going to start by introducing our expert panelists and talk about where we are today and what we know. So joined today by Dr. James Bingle. Dr. James Bingle is from ProMedica Physicians Cardiology. He provides advanced cardiac services at most hospitals and 12 office locations in Northwest Ohio and Southeast Michigan. In 2011, in addition to his cardiology practice, Dr. Bingle became president of ProMedica Heart and Vascular Institutes. In 2018, Dr. Bingle partially retired and now serves as a cardiovascular cardiology consultant for ProMedica Physicians Cardiology. Dr. Bingle is a longtime volunteer for the American Heart Association. He and his wife, Nancy, have 5 children and 5 grandchildren. Another of our expert panelists is Dr. Ahed Nahhas, and he has been an interventional cardiologist at Toledo Clinic Vein Center for over 35 years. Dr. Nahhas is an active clinical researcher in cardiovascular diseases and pharmaceutical research in national and international clinical trials. Dr. Nahhas specializes in the evaluation and treatment of coronary and peripheral vascular disease, cardiac catheterization and pacemaker implantation, coronary angiography and stenting, peripheral angiography and stenting, and carotid artery stenting. He also specializes in the evaluation and treatment of varicose veins and disease. We're also joined by Barb Roose, who is a popular speaker and author. Since 2005, Barb has been speaking to audiences in the United States and abroad. Barb is the author of multiple books and Bible studies, and her writing has been featured in many magazines and blogs. Barb and her family live in Northwest Ohio. And finally, we are joined by Sara Hegarty. Sara is the Executive Director of the American Heart Association for Northwest Ohio. Sara oversees all American Heart Association events and mission-based activities in Toledo and throughout Northwest Ohio. So I'm going to stop sharing my screen, and I'm going to start by asking some questions. And I'm going to ask the first question to Dr. Nahhas. Dr. Nahhas, we have approximately 90 people who are on this call right now. And as a cardiologist, what should heart patients know about coronavirus? And based on current information, what suggestions can you make that heart disease and stroke patients and or survivors should know to best protect themselves amidst the COVID-19 pandemic?
Great. Thank you very much, Tim. This is a great program. I hope will enhance the knowledge of many people in this community. This virus is in a fluid state. The knowledge about it is changing almost daily. We know from the experience in China as well as Europe and United States, people who have cardiovascular disease, including stroke, are more affected than anyone else, and they are likely to have bad outcome if they get the virus. So it's really extremely crucial that the people who are caring for patients with heart disease and vascular disease are aware of what could be done. And everyone is talking about social distancing and hygiene, of course, wearing face masks. There could be cloth mask. If you have any suspicion about anyone in the house or anyone you may have encountered, and also in public places, obviously the medical mask should be reserved to healthcare workers because there's not enough of them. Let's say if there's somebody who got exposed to someone who may be infected or suspected to be infected, who comes in association or in contact with those people, people should practice self-isolation in the house and wear a mask and stay away for ideally 14 days with minimal contact, because asymptomatic people could give the virus to someone who is at risk. And every small and bigger studies so far that were published, Europe, China, as well as the United States, showed that people with heart disease have at least horrible increase in mortality if they end in the ICU. And out of 100 people who get to be intubated, only 20 of them will survive. So it's really important to practice prevention as much as possible. And I'd like to point out that shedding of the virus in some studies was isolated in up to 37 days. Median is 20 days. We believe 14 days is reasonable, but the quantity of the virus or the viral load, as well as the time of contact with potentially infected or carrier people, are important. So if you pass by someone who may have the virus and you have 2 seconds, you're probably not likely to get it. If you spend half an hour face-to-face and there's some talking, speaking, it could really increase the risk. When those patients with heart disease are at home, they need to also take good care of themselves by taking the heart medicine, by exercising as much as possible, maybe 40 minutes a day, having good diet, and above all, have good sleep, no less than 6 hours at night. And if they have any symptoms, they need to recognize it and seek medical attention and get further advice. I mean, this is in brief what I can think of to be of importance for the public and for all of us to follow.
Thank you so very much. Before I get to the next question, I want to give a couple logistical information. Everyone is everyone who's participating in this, other than our panelists at this point, your microphone is on mute. But if you'd like to, we have a chat box that we're going to be monitoring. Several people have already submitted some questions that I'll be asking our panelists. But if you have a specific question you would like to ask, please feel free to ask that in the chat box. We are joined by a very broad spectrum of general public, heart disease and stroke patients and survivors, many medical healthcare professionals, as well as several different community agencies. So feel free to introduce yourself, and if you have a question to ask or a resource to share, please feel free to use that in the group chat. Dr. Bingle, next question is for you. We have read that some are at greater risk than others of having complications and being hospitalized with COVID-19, including those who have underlying conditions. What do I need to know about the coronavirus if I have high blood pressure? And for people who are also already on a medication or medications, be it a statin or blood pressure medication or medicine for heart failure or any cardiovascular related condition, should patients continue with their medication as already prescribed?
Okay, a lot of that jumps on the back of what Dr. Nahhas just said. You know, anybody with hypertension, amazingly enough, has much the same risk as those with what we would consider chronic heart conditions. Actually, coming into this, I kind of didn't feel hypertension in and of itself was that much of a risk factor for some of these complications, but studies primarily from China, some of the early places in Italy have shown that hypertension is really linked to developing the process much more severely than the other people without it. So we really have to watch it for the hypertensives and use a lot of the precautionary things that Dr. Nahhas talked about earlier, you know, the self-isolation, the mask, the hand washing. If you do get infected, just do as best as you can to control the symptoms at home. If you can stay at home, that's by far the best. As far as medications, there was a concern initially about taking medications, which a lot of high blood pressure people are on, ACE inhibitors and ARB agents, angiotensin receptor blocker agents. Common ones are lisinopril and losartan, ramipril, Altace. There's a lot of these medications. If you have high blood pressure, and particularly if you're on a couple medications, it's very likely you're on one of these pills. There was concern that it was allowing the infection to be more aggressive in people with these medications. Presently, recommendations from American College of Cardiology, American Heart Association, and all the organizations that have weighed in looking at all the information is you just keep taking your medicines if you're on them. There was even some thought that they might be protective, but like so much of what we're dealing with this coronavirus epidemic, we don't know for certain what's the right thing. We will learn over time. We're going to come out with a whole lot of things in the next year about this. I'm certain of that. But right now, stay with your medications. In fact, as Dr. Nahhas emphasized, please be sure you stay with your medications, because treating your heart complications will, if you happen to get this, certainly help you get through this thing. So from that standpoint, blood pressure, it's much the same as having a chronic heart condition. Consider yourself as having a chronic heart condition. If you have hypertension, take the precautions Dr. Nahhas said, stay on your medications.
Excellent. Thank you. More specifically on a local level, can you give an update on Lucas County in terms of number of positive identifications as well as testing status availability throughout the county?
Yes. ProMedica, which is where I'm most deeply involved with, is actually, keep your fingers crossed and knock on wood, it appears that things are going relatively well. We have had our share of COVID-19 cases. Also elsewhere, the community really has come together, and Mercy and St. Luke's and other major UT are everybody's sharing their information together so we can get a broad picture of this. Initially, as I believe most of you are aware, there was predictions for fairly gloom outlook. It is gloomy. What's happened is horrible.
but it appears that it's been mitigated quite a bit with our social distancing and the Governor DeWine and what he's implemented. As far as numbers, the hospitals are nowhere near capacity for this issue. There's been discussion about the ventilators. If you watch Governor Cuomo from New York and the concern about having enough ventilators and everything, that thus far is not even close to being a problem here. So we really have mitigated the impact of what could have happened here in Northwest Ohio. We are seeing some trickling down from Detroit. In ProMedica and Monroe and Adrian took some patients, systems that were somewhat overwhelmed there. If you watch the news about Detroit, it's amazing how close you can be and have a much different situation than we have. But so far, it's been running pretty good here in Northwest Ohio, and I anticipate that to continue. We hope that, you hear about these curves and everything flattening out and everything. We hope we've flattened out and we're hopefully approaching the downside of the incidence of COVID-19 cases in the area.
Thank you. Dr. Nahhas, do you have anything to add to that?
Well, I just want to remind everyone who's watching that there are many other risk factors that increase the risk of the patient for infection. Diabetes, obviously hypertension, chronic lung disease like COPD, chronic kidney disease, obesity is a risk factor as well, and people who are immunocompromised, people who had some kind of transplantation or on immunosuppressive medications for Crohn's, celiac disease, and so forth, so many of them. These are very vulnerable group of patients, and we need to keep that in mind. Thank you.
Okay, next question, I'm gonna go ahead and turn to you, Sara. I'll spotlight your video. So Sara, you and I both work for the American Heart Association. So can you tell us how the American Heart Association is making an impact during the coronavirus pandemic?
Absolutely. We originally started out with fast tracking $2.5 million in research funding. And this funding is to fast track some cardiovascular research on how COVID-19 is going to affect not only the heart, but as well as the brain. We are also helping accelerate antiviral drugs to combat the virus through the Lawrence Livermore National Laboratory. The AHA technologies are being used in the COVID-19 response. This will lead to better diagnosis as well as treatments. Now, when it comes to locally at the front lines, we are offering free resources to our frontline workers to help bridge that gap in training in different technologies. So we have been in contact with different hospitals on how we can support on that end. As well as we have added a COVID-19 data registry powered by our Get With The Guidelines to help better manage existing patients.
Wonderful. Thank you so much. So Barb, next question I'm going to ask you, which is that we all understand the stay-at-home order is what is best for our physical health and for the health of our community, and we are all doing everything we can to adhere to that stay-at-home order. However, it is very challenging for mental health. Many people's stress is through the roof. What are some tips to help us all cope?
I want to say that the beautiful part about coming together is that we do have the advice of our medical professionals. And so I'm sure that everyone here would say thank you to those who are on the front line in healthcare, who are trying to give us the information that we need that keeps us safe. I know that for many, especially when there are other underlying factors, that all this information coming at you from your medical professionals and then the information coming at you from the news, it can feel overwhelming. However, there are still choices and options that we have every day. So what this looks like for us in the midst of what we can't control are the choices that we can make for our head, our hands, and our feet. And so mental health wise, there are still things that you can be thankful for. Now, on one hand, it's okay to not be okay. If you've been feeling stressed and overwhelmed, don't beat yourself up for that. We've never been through a pandemic before. No, none of us know what we're doing in the midst of having a pandemic and having to stay at home. So it's okay not to be okay. But the best thing that you can do for yourself, and I do this every day, is to wake up and to be aware of what you're grateful for. We are in a difficult time, but we do have great health care. We do have food systems that are staying stable. We do have a social structure that is able to endure. And so finding ways to remain thankful is important. Secondly, is as you are trying to remain thankful, make sure that you know how to keep moving, whatever that looks like for you. And I've got some other practical tips I'll share in a bit. And then to stay connected. Isolation and loneliness are a huge deal, but just one phone call to a friend a day, one-to-one, that can help make you feel a little less alone, a little less stressed. Make sure it's a friend who is going to be life-giving, not one who's going to complain. But just one connection each day can help you increase your wellness and mental health.
Excellent. Thank you so much. Next question. We're going to go back to you, Dr. Nahhas. Can you just quickly go over medically, what are the symptoms of COVID-19? And locally, for anyone who develops coronavirus symptoms, what should their next steps be?
Right. This is really very diverse group of symptoms. Fever is definitely the most common. Could be low grade, could be very high grade, extremely high grade. Some people get fatigue. Fever is like 99%. Fatigue is about 70%. Dry cough in 60-70% of people, according to published literature. Some people, a third of patients, that is probably the most scary symptom, because it could lead in some patients to progressive in a day or two to respiratory failure. Cough is also not uncommon, maybe 30-40% of people, and most of the time it's a dry cough. Occasionally it is productive cough. Nausea, vomiting, abdominal pain, and diarrhea these symptoms have also been reported in some patients. If that patient is having symptoms that are not explained by an obvious infection or pathology, then COVID-19 should be suspected, mostly if they are a high-risk group of patients like the ones we mentioned earlier, with hypertension, diabetes, COPD, kidney failure, obesity, and so forth. In that case, obviously a phone call should be made to the provider. Self-isolation is recommended, as we discussed earlier, if patient is not feeling really horrible, so minor symptoms could be managed at home. And that's seen in about 80% of people. And many of these patients, they think it's something mild, nothing. Occasionally, some people have dyspnea that is also could be watched at home as long as it's mild and people are oxygenating well. Some patients may have oximeter at home that can measure their oxygen level. And if it's still normal and they're breathing and feeling fine, they could stay at home. Obviously, talk to their healthcare provider on a daily basis. Self-isolation, they need to wear a mask, be isolated somewhere in the basement, get food delivered to them, and be away from other family members. What I want to point out is that of the known knowledge that we have, 10% of immediate contact may get the infection, up to 10%. In some literature, they said 3%, 4%, but everyone in the household will. There's different immunity, different other factors that are not clear, but there's a risk. So you need to self-isolate. And if there's deterioration in clinical condition, then people should be in the hospital cared for. And as I mentioned, of the people who have the report that came from China of over 44,000 infected individuals, about 5% of them were critical. And out of the 5%, about 2.5 ended dying. But none of the less critical patients died, according to what they published. So as long as you're feeling well and you're managing, staying at home is a good idea to conserve healthcare resources at the hospital. And if things are bad, then you have to be in the hospital, hoping that you don't get intubated. but supportive care early on, adequate hydration, nutrition, sleep, Tylenol to reduce fever. It's called supportive care. Some people take chloroquine with Max. That is typically recommended in the hospital because of chance of arrhythmia and causing problem by some of these medications. So that should not really ideally be taken at home. That's in a nutshell the general.
A couple of things as clarifications. One, I did in the chat box, I did type in the number that the Lucas County Community COVID-19 call line numbers which is a 24/7 number. For English, it is 419-251-40000, and there's also a multilingual number. I'm also getting a couple of messages related to this question. One, please have the presenter explain dyspnea for the non-medical people on the call. That's shortness of breath, yes?
Yes, that's correct. The term is shortness of breath. So if you're feeling suffocated, but if you're just a little harder to get your breath, that's the type of symptom that people are experiencing with this virus.
Okay. And then also from an employer perspective, to either of the physicians, do you know what the official guidance is on what is the temperature guideline for employees returning to work? Some places have been reported 100.4 and recently heard this has been lowered to 100 by the CDC. Can you confirm?
You talking to me, Tim?
Yeah.
Okay. I think that the temperature you have to have, regarding return to work, it's really tricky and it's changing. You have to have negative tests. You cannot have a virus. You have to have 7 days without taking any medications to lower your temperature and be feeling well. If you were tested and your IgG is positive, which is the antibody to the virus, and you're feeling well for 7 days, then you're safe. But if you have, I read something this morning, like if you have 7 days pass by, you have no symptoms, no fever, you're not taking any medicine, even though 3 weeks ago you may have had symptoms suggestive of the virus, but you were never tested, it's also viewed as safe to go back to work. But if there's fever, definitely, and you have suspicion for infection, these people are screened at the door of hospitals as well as Toledo Clinic, for example. We do that, and we investigate them. We don't allow them to go back to work if they have any fever that is not of a clear origin.
So do we know an official number for a fever for people looking to return to work?
I'm not aware of exact number, but anything more than 98.6 is fever. And according to the reported, the published literature, some patients may have low-grade temperature. It depends on their immunity. If someone has still good immunity, they would produce high temperature. If someone is immune compromised, they may not have high temperature.
All right. Well, Dr. Bingle, anything to add to that?
Yeah, Tim, the whole going back to work is a tricky thing. Exactly what Dr. Nahhas said is what is promulgated, the 7 days, and you can check the antibodies, they're positive, watch the fever. But like so many things with this virus, we don't know for sure. We're trying to make our best guess, particularly with providers that need to be at work. We're trying to hopefully get them back as soon as we can, but not too soon. There is a belief generally that the further you get into the infection, the less contagious you are because your viral load is less, so you're going to be putting off less virus. So the further you are from initially having the symptoms and having the diagnosis made, the further down the road you are. But there's so much unknown about asymptomatic spread and things of that nature that we'll know a whole lot more. But I believe what Dr. Nahhas said right now, I have heard the temperature of 100 degrees being the one that it's kind of interesting to me, because I would concur with Dr. Nahhas. If you've got a temperature over 98.6, something's probably going on still that you should watch. And I would personally tend to use that for my patients and stuff.
Okay. So Dr. Bingle, I'm going to ask you the next question. And we've been hearing that hospitals are strained right now. You explained where we are in Northwest Ohio in terms of capacity. And just what are guidelines? Should people still call 911 if they think they're having a heart attack or stroke? And what are the first signs or symptoms of a heart attack or a stroke?
It's pretty easy. If you feel, and I'll go through the symptoms and stuff, but if you're having symptoms that you're concerned about, you call 911 and we'll deal with it, and the first responders will deal with it. they're living with this, trying to make these calls on the run as things go on. I would go back to the first initial part of the question about hospital and resources being strained. You know, it's the providers that are being strained, and I can't speak to that because I've been sitting at home making my calls for a variety of reasons and not on the front line. Those are the people that are getting, in fact, are in contact daily with a number of people with COVID-19. And the key is to try, that's the whole reason for the social distancing and everything and staying at home. The big deal is to keep our providers able to provide care. We've been very successful. Lucky might be the word, but maybe it's because of what we've done. We've been very good at this social distancing, and it came on early through the governor, and I think it has been effective. But as far as heart symptoms, if you're having a heart attack, symptoms mainly are discomfort in the chest. Classically, it's a pressure, but as Dr. Nahhas can tell you, having done this for years, the symptoms vary quite widely. Shortness of breath, chest pressure, odd feelings in the upper chest, the arms, the jaw can be a big sensation. And generally just not feeling right when you're having those symptoms coming with it. Sweating, cold sweats would prompt a call to 911. And don't hold off on doing that. You need to do that. We need to take people in, make an assessment, and go from there as far as whether they're having a heart attack or not. Same is true for strokes. Symptoms for stroke include the facial drooping. It looks a little different, like one side of the face is weak, one side arm or leg being weak. Speech difficulty, someone jabbering and kind of not making sense is another symptom that's very common with stroke presentation. And with any of those, when they're coming on, again, 911 is where you go with that, even in the face of the coronavirus epidemic. I have no doubt that we need to handle this situation.
So absolutely, if you have any heart attack or stroke symptoms, immediately call 911.
No question.
Okay, thank you so much. Dr. Nahhas, we've been hearing that hospitals have canceled or postponing elective surgeries and taken other steps to make sure they can handle patients who develop severe cases of COVID-19 and other emergencies. But people with serious non-corona medical emergencies should not ignore them. If I have a non-corona medical situation, what should I do? And what is considered elective? And can you offer any guidance on deferring non-urgent cardiovascular testing and procedures?
Actually, I think that is a very timely and great question, because there's misconception, I think, what is emergency and what is not. I want to just start by saying that the STEMI is people with heart attack that we normally take them to cath lab 24/7 and open their blocked arteries. The calls for emergency catheterization has dropped 40% in Europe, as well as in the most busy 9 cath labs in this country. And we think that is caused by fear of going to the hospital. So patients are having symptoms that before the virus era would call 911, go to the hospital and get treated, and emergency catheterization and opening the artery is typically the best care for that group of patients. And now they're scared. So they have symptoms and they wait on the symptoms, and some of them may end dying, some of them may not. And those who are not having bad outcome immediately, I think in 3-4 months from now, we're gonna see surge of people who have complications from heart attacks that did not kill them. So people still have other emergencies, could have appendicitis, inflammation of the appendix, or gallbladder, acute abdomen. So if you have anything really that is very bothersome, whether symptoms or illness, you should still seek medical attention and not be too scared, because if you die from ruptured appendix or cholecystitis, or die from the virus, what difference does it make? Death is death, whether you're hit by a car or die from a virus. So I really think that we as professionals, we have to make sure that people understand that we are still taking care of emergencies. Surgeons are still operating. You have medical emergency other than virus that is still taken care of. Regarding the heart in particular, I want to make sure that I explain this point well. Anything that is not going to make a difference in patients' outcome regarding survival, we are postponing. Like someone who has a blockage, they're doing well. We know they have blockage based on a stress test or based on some symptoms that are stable. This is not the time to put them in the hospital, consume hospital resources, and expose that patient to the virus that is obviously more prevalent and available inside the hospital. So ideally, you want to defer everything that is not going to lead to bad outcome until the virus is controlled and is safer to be in the hospital. And this way you can conserve hospital resources as well.
But certainly be in contact with your medical professional provider.
Right.
Okay. Dr. Bingle, a couple questions. For people who don't have a primary care doctor but need to talk with someone, especially in a non-emergency situation, what can they do?
ProMedica has been proactive here. There's a ProMedica on-demand site where you can have a live video visit anytime with a board-certified provider through your mobile device or computer. Open to all ages. Don't have to be a ProMedica patient. You download the ProMedica on-demand app on your mobile device, or visit. There's a site www.promedica. Let me see, I got it written down here. ProMedicaOnDemand.org. www.promedicaondemand.org to sign up. Also, Tim, I just did COVID-19 and ProMedica search on my laptop, and it came up, there's an interesting COVID-19 informational site that ProMedica has set up. One of the things they have is kind of a self-assessment. Dr. Nahhas was talking about the symptoms previously with COVID-19 and stuff. There's a self-assessment, very easily accessible, right up in the right upper hand corner, quite large, that you can click on and go into if you're concerned at home and having questions about your symptoms and stuff, and it'll give you an idea or a feel about whether you should be concerned or not. As far as getting contact with people, the ProMedica On Demand is a great site to go to. If you don't have a primary care provider, again, you don't have to be in the ProMedica system to utilize this.
Okay, and those are via telehealth. So there's been an increase in adopting telehealth virtual visits in order to reduce in-person visits so as to slow the spread of the virus. What does that look like from a patient perspective?
I can't say from a patient perspective, but from a doctor's perspective, it's been pretty interesting. I was talking with Dr. Nahhas before we went on the screen here, and I think it's going to change things fairly dramatically. You know, we have, particularly with cardiology, we have a population that tends to be elderly, and people have trouble getting rides, getting in, they need transportation to get in. And with the now I've just been doing it on telephone. Dr. Nahhas has had a video connection in his calls, and he can maybe speak to that a little more, because you do read body language, and I think visualizing people in that visit, I've always felt is quite important. But even on the phone that I've been doing the tele visits, I really feel that I'm getting a good feel for what's going on with that patient and whether or not we need to be more aggressive in seeing them sooner. We're trying to keep people out of the office, trying to keep people out of contact with each other, and that's the reason that we've been utilizing this much more. You can usually, I believe, you can very confidently tell when somebody needs to be seen sooner. So I think it's going to be a real wave of the future going forward. It's been kind of interesting to do it. I'm not a techie, to say the least, but I really have found it to be pretty fascinating and helpful.
All right, thank you very much. Next question, Barb. As the community continues to practice social distancing and adhere to the stay-at-home executive order, do you have any tips and strategies to support mental health and well-being?
Yes, I do. And so what I would love to start first with everyone, and we've absorbed a lot of great information. And so do one thing. Take a deep breath with me right now. I know it sounds crazy, but right now, just inhale from your gut, just inhale, and then just push it out slowly. I don't know when the last time is that you've been aware of just taking a deep breath. Just do it one more time. You'll notice that your shoulders will drop a little bit. It also helps to slow our heart rate down. The tension that we're all feeling is real. And when we're not aware of just taking that deep breath and giving ourselves a chance to settle in, we then live with this tenseness, and our body feels it, our heart feels it, and our mind feels it. And so the very first thing is to just be aware of that tenseness in you and take a deep breath. The second thing that I've discovered is during the COVID crisis, we're home all day, all along, and my refrigerator talks to me all day long. My refrigerator, it tells me everything that's inside of it. It wants me to come visit it as often as possible. So I've had to learn how to be the boss of my decisions. Whether you are doing a grocery pickup or whether or not you're still going to the grocery store, you're still in charge, or someone's going for you. You're still in charge of the food that's coming back home. And so one of the best things that I can do for my mental health is to make sure that I'm feeding my body well, because when I feed my body all kinds of yuck stuff, then I'm gonna eventually feel yucky. So for many, many years, I have done salad in a jar. This list lasted in my life long before the COVID crisis. Guess what? It's much faster to eat fast food than it is to eat healthy food. So something simple like creating salad in a jar for me is how I make healthy food fast food. Pinterest has all kinds of recipes, but once a week, I buy my fruits and my vegetables, and in the course of an hour, I chop everything up, I put it in this glass mason jar, and I have a row of them in my refrigerator. So that when I go in to eat, I give myself a chance to make healthy decisions. I read a study last week that loneliness can actually create hunger. So it's not a surprise if you're all being very hungry because emotionally you feel distance. Help yourself out. Be kind to yourself. Do some salad in a jar and be really ruthless when you're making out your groceries. Comfort food is comforting in the moment, but it is not comforting long term. So make really great decisions. And then finally, one of the things that I realized is I have to keep moving my body for my mental health. And so my tennis shoes and my Fitbit, I have a step goal every single day. And it can be just walking around my home or getting outside and taking a walk. I'm a writer. By virtue of my job, it's sedentary. And so making sure that I'm intentional about moving, it definitely lifts my heart and my mind. So those three things, just taking that deep breath, making sure that you're making good food choices, be the boss of your food choices. Don't buy the healthy food and unhealthy food, you won't eat it. And then making sure that you move. Let me add one more. Turn off the TV. Like, we've seen all the news. We have read all of the Facebook posts. Turn off the television. When there's stuff that you need to know, you'll find it, but be kind to yourself and limit the amount of information that you consume. It is not helpful to keep just swirling in it all day long. So those are some of my tips.
Those are excellent. Thank you so much. Wonderful advice. Dr. Nahhas, I want to run through quickly a few more questions, then we'll get to the questions from everyone else. But for the healthcare professionals who are on the call, can you give us an update on clinical guidance and any care considerations for patients who have cardiovascular diseases?
Well, that's probably similar to what we started with. People who have cardiovascular disease, they need to be, is that the question? What recommendation for people with cardiovascular disease?
For any clinical guidance, yeah.
Okay. Well, I want to just mention a few facts. When people with COVID-19 are admitted to the hospital and ICU, we have positive troponin, which is a marker. I mean, if physicians and non-physicians, marker of myocardial damage, seen in about 30% of people. And there's true myocardial damage indirectly or directly from the lack of oxygen or from the virus directly affecting the heart. So you see all sorts of things from inflammation of the heart muscle called myocarditis to the pericardium around the heart. You have arrhythmia. You have also plaque rupture causing heart attacks. And many patients actually had the heart attack inside the hospital from the hypoxemia and stress and all that. So it's really bad to end in the hospital if you have coronary disease. And every effort should be made to protect this group of patients and minimize their chance or the risk of their ending in the hospital. If they have the acute MI, one thing that many places have started doing, we haven't done it yet in Toledo, use thrombolytic therapy for heart attack management, except if the widowmaker is the cause of the heart attack. And thrombolytic therapy would minimize the exposure of the healthcare workers, the cardiologists, and the staff to the patient later and all that, minimize the risk of infecting the healthcare workers, mostly for the heart attacks that are low risk or are viewed as low risk of causing death to the patient. This is really being practiced in many other cities, Louisiana, New York, and other areas. And it's really a good way of taking care of the patient, minimizing the risk on the professional doctors and others taking care of the patient.
All right, thank you. Dr. Bingle, we just got a question from Kaylee from WTOL 11. She says, what are some things that people with underlying conditions can do to try to stay as safe as possible if they have to go out for essential things such as groceries?
Well, ideally, you limit that as much as possible. Try to see if friends could, family members, get out instead of you doing that yourself. That would be the primary thing. If you had people rely on them, this is a time that we do really need to rely on each other more than anything else. That's one call a day that Barb was talking about, I think makes a whole lot of sense. And if it's 2 calls a day, so be it. But try and use others to do it. If you can't, and if you're the one that has to do it, certainly keep your distance. Really make a point of being even awkwardly at keeping apart from other people. I think wearing a mask for those people is definitely warranted. I believe that's pretty true for everyone, but for them in particular, wearing a mask is definitely something they should be doing. The distancing, gloves is another question. Gloves is probably, if you have access to gloves, it's probably a reasonable thing to do for those people to utilize gloves. Take them off when you get home. You need to be meticulous with this. When you're bringing things in, if you can sit them out, if you don't need them right away, sit them out for a couple of days, the table in the garage or in a laundry room or wherever. It is also advisable wiping them down. We've all seen the TV station show instances of people wiping down their groceries. It's a pain to do, but it does help quite a bit in minimizing the possibility of getting impact on these people that are already somewhat compromised and at higher risk for developing problems.
Okay, thank you. And then, Dr. Nahhas, I'll ask this last question, medical question to you. In that we're all dealing with seemingly endless questions about the coronavirus, and it can seem like there is an overwhelming amount of information out there. Where can we go to get reliable medical information and timely updates for guidance?
Yeah, that's another great question. I think there are a lot of misinformation on sometimes TV and through the internet. The CDC, Center for Disease Control, is probably the most reliable source. Locally, the Ohio Department of Health is other great source as well. And our governor every day, except for Sundays, some Sundays they did it, they have also an update at 2 o'clock in the afternoon. I think it's channel 9 on Buckeye. That gives the public good information as well as recommendation regarding the status of the virus and the state and so forth. So these are really the sources. I heard from somebody yesterday that some people are saying the virus can go through the G5 network and through the cell phone. That really doesn't make any sense, but I think people need still to talk and connect and be socially active indirectly to help decrease the level of stress. I want to bring a couple of points that I think would be important. Social isolation or distancing doesn't mean that people should be confined to a room all day, every day. If everyone is well for the same family, then that's fine. If the person has to take a walk the dog in the neighborhood, that is great. They don't need a mask while walking the dog. They probably should not be stopping and carrying a conversation with a friend for 10 minutes or so. Common sense is a good idea. If you see your friend at the department store, you're wearing a mask, you can still talk to that friend, say, how you doing, instead of ignoring them and being rude and walking away. The virus exposure, the duration of exposure, as well as the load of the virus are 2 important factors. And we need to stay human and keep our connection for our sanity and all of that.
Thank you very much. one question, Dr. Bingle, I'll go with you for this question. It says, I work with at-risk pregnant women, and I'm looking for information to share in regards to preeclampsia, gestational hypertension, diabetes. What questions should client population be asking during telehealth visits?
That's a great one. I don't work with that population much at all, but I would presume it's much the same as our patients that have cardiac issues. If they're having symptoms, asking about them and asking, describing them to the provider to get a handle on whether they're important or not. Also finding out what should be monitored. These are people calling in from home on telehealth visits, Tim. That's the scenario that we're looking at here. Yeah, I would think that those would be people that may be having blood pressure cuffs, checking sugars closely, and things of that nature, and certainly providing any objective data that you can to the provider is going to help them along in that regard. Being truthful with your symptoms. You know, we all tend to either, some people minimize, some people maximize, but whatever, letting the provider know exactly how you're feeling and what is different than normal for you, I think would be very key in that situation. Pregnancy is a real interesting thing here with the COVID and COVID-19 infections. And again, that's not my field, so I don't want to speak out of turn there, but there's a lot of people working with that and have data that would know a whole lot better than myself. Those in obstetrics that deal with it every day would have a much better handle on what to look for in that situation.
All right, thank you very much. Sara, question. Many of the participants on this call are volunteers, donors, and supporters of the American Heart Association, and also rely on AHA information and guidance. Where can people access heart-healthy resources from the American Heart Association? And locally, how can people stay active with the American Heart Association in Northwest Ohio?
We have a lot of different opportunities. As we know, the majority of us are now working from home. So we have put together some great Move More tools. So when you're in your home office or with your, you're still able to stay active. As Barb pointed out, staying active is key for so many of us, not only for our physical health, but for our mental health as well. So those can be emailed out. So feel free to reach out to either Tim or myself, and we will email them out. We have already distributed a lot of these toolkits to our employers around town. We also have Facebook Live workouts on our Facebook pages daily in the morning and then again in the evening. So if you want something to do with your family, you can go to our social medias and catch one as well as we just launched our cabin fever, and there are activities to do with your family to break the cabin fever, to get the whole family together. So whether you're looking to create a circuit training for things in your household or to go for a walk and a scavenger hunt with your kids to keep them active and out of the house and change things up, or work out through social media, we have tools for you.
Excellent. Thank you. I think the final question I'm getting from the chat box, one person wanted to share that Health Partners of Western Ohio is available for telephone and video visits for patients who may not have a primary care provider. Thank you. And then Dr. Nahhas, I'll ask this question of you. It says, my husband has a pacemaker defibrillator and recently had a VT ablation due to numerous shocks compounded with COPT, recent lung surgery. What should procedure be should he get shocked again and fear of being exposed to the virus?
If that above patient is definitely high risk, if they get shocked again, that means thank God that patient has an ICD, because that's the reason the patient has a defibrillator, because this group of patients at risk of malignant arrhythmia. So if there's a shock and only one shock, usually this patient had malignant tachycardia or rapid heartbeat, and it's appropriate. Most of the time, nothing is needed. If they're taking medication that can affect their potassium and all that, then a blood test may need to be determined. Really, there's rarely anything else. If someone keeps getting shocks every 5 minutes, then they need to obviously be evaluated, and sometimes medication may need to be adjusted, or there may be a reason for that. But every now and then, if a patient with ICD gets a shock, that is the reason we put ICD in people, defibrillator in patients, because without the defibrillator, they would have died.
And Last question for Barb came in. Barb, as we plan for what's next, what are your thoughts on post-traumatic stress syndrome or anxiety transitioning from our socially distant world? Big question.
It is, and it's also a question that in my world, amongst those of us who create content online, we've started to think about that. Because once this is the critical part, we're all going to carry the effects of what we've experienced, what we felt far beyond. What I like to say is for now is not forever. There is going to be life beyond the COVID crisis. And so what you do today is planting the seeds for what you're going to experience tomorrow. And so what I would encourage you to do is make the decisions today that are going to bless you tomorrow, because there are going to be just some of those traumatic things you're going to have to sort through, but you're going to be able to sort through them much better if you're in an emotionally, mentally, spiritually, and relationally healthy frame of mind. So plant seeds of wellness today to help you weed through whatever you've got to weed through in the future.
I'm going to try this. Actually, I'm not going to try this. I was going to hope to ask everyone, several questions have been asked via the chat box, and I wanted to give a chance to anyone to ask any questions, but I think with our technology, it's going to be difficult for that to be able to come through. So I'm going to go ahead and not do that. If you have a question that you'd like to ask, please feel free to enter that in the chat box. Like Sara said, since this has been I hope you have found this to be a worthwhile use of your time and to get some timely information that's reliable from the American Heart Association. And we all know that this is a dynamic and challenging situation, and the Heart Association does everything we can on this organization to be a reliable and trusted source of information based off of credible science. We will continue to be your partner in health and well-being as we share the latest updates. So no matter who you are, where you are, the Heart Association is here to help you, providing those trusted science-based tools and resources to empower you to take charge of your health and well-being. Grateful to all of you who have worked with us to build a healthier community for everyone. This is our new reality, so we're trying to to adopt these challenges for all of us as we press forward together to achieve this mission of being a relentless force for a world of longer, healthier lives. So I want to thank everyone for taking the time to be on this call today. I'll put together an email and send it out to everyone. If anyone else has any other questions, please feel free to reach out to us at the Heart Association. Let me check the chat box one last time, if I can get to it. Is there anything else that we need to say? Sara, do you have any closing remarks you'd like to give?
No, I just really appreciate everyone attending today, taking time out of your busy schedules, and hopefully we're able to get together more often with this technology to band together to get through this uncertain time. So thank you.
All right. Thank you to our panelists, Dr. Bingle, Dr. Nahhas, Barb, Sara. Thank you so much for your expertise and for all you do for our community. Thank you so much. We'll look forward to talking with everyone sometime again soon.